concrete floor.
Right.
What are the red flags that should tell someone I need to seek medical care versus let me just see how I feel in a day?
So that's a great question. So the biggest things that I think about, and you would know this if you come in and you're one of those patients, because it's going to be the first questions I ask is, do you have any arm pain? Like if you hurt your neck, I'm going to ask, do you have any arm pain? Do you have any leg pain? Because if you damage your spinal cord, if something is broken and things are moved, the scary stuff, you're going to have nerve problems. If your neck hurts and your neck is sore, and especially if it's worse when you touch the muscles, then we put it in that musculoskeletal category. Now in the clinic, if you're here, I'm going to take an x-ray of you. But if I was in the hospital and someone slipped and they hit their head and they said my neck is sore, but they can move it around okay, their arms are fine, their legs are fine, most of the time we would say that we're thinking this is just musculoskeletal. It's not medical advice, don't hold me to that. But that's kind of the way we think
Right.
about that. And if that happened to my friend, that's what I would tell him. Give it a couple days.
Right.
Anytime you have weird electrical feelings, neurologic sensation, my arm is weak, pain shooting down your arms, things like that, then we'd say, stop what you're doing, go to the surgeon or go to the hospital, get x-rays and make sure. And what's worth noting is even most of those people are fine.
Right.
But that's our, when you talk about red flags, if we sent all those people in, we're going to catch pretty much everyone that has a real problem. We're also going to catch a lot of people that don't.
Right.
But the way I view what I do is I need to have what we call high sensitivity. So I need to be very sensitive to capture things, and I'm very risk averse. So that way I don't make a mistake and miss something. But we shoot a bunch of x-rays here on people that are normal for that reason.
Mm-hmm.
But that's what I tell people. It's reasonable to tough it out if you're sore. You have weird symptoms you haven't had before. Don't be a hero. Go see someone.
And as a PT, I'm going to go ahead and say some of the things that people don't often equate to potential spine injuries are bladder and bowel and paresthesias in the area that if you sit down on a bike or on a saddle, the saddle paresthesias, people often don't associate that.
Right.
But if you fall, hit your head, or slip and have those symptoms, they need to come see you.
Absolutely. And I would say, yeah, if you're outside the building, I'd bring you into the office. Otherwise, I'm going to tell you to go to the hospital. And it's because in the ER, we can get the CT scan quickly and look. We don't frequently think of things like in the genital region as being nerve related, but they're all driven by nerves.
Right.
So, I've probably treated somewhere between 10 and 15 people that have had an emergent issue with that in training at major trauma centers, so high volume areas. And when you look at the symptoms they come in with, that saddle anesthesia or saddle numbness is very common. Bowel and bladder incontinence, where someone will say, I pooped or peed and I didn't mean to. And we distinguish that. That's not, I couldn't make it to the bathroom because my back hurt. That is, I looked down and I was just peeing the bed, And then the other thing that's common and is embarrassing, so it doesn't get brought up, is male sexual dysfunction. So they'll say, I had an erection that didn't go away and I don't take any medication for that. Those types of things can be related to the spine injury. So, and it's because the nerves that go to that whole area are the last nerves on the spinal cord. Anything that is abnormal, you want to say it's better to rule that out and make sure everything's okay. And the main reason behind that is those symptoms, the ones you discussed, are the ones that are potentially irreversible. Things like pain and numbness, even when we find disc herniations, we can sit on that sometimes because if it gets better with therapy or better with anti-inflammatories, the symptoms go away. When you start having muscles that are weak or sexual dysfunction or numbness around the genital region or bladder control that you lose, that might be gone forever if we don't address it.
Do something quickly.
Right. Now, again, this is extreme minority percentage of the population, but
just
if the friend,
red flags.
the friend tells you they can't pee all of a sudden, don't let them, tough it out.
Got it.
Drive them to the hospital.
Got
don't
it.
let them drive either.
So rare, but
Rare, but you should know that.
dangerous.
Correct.
Okay. Now let's go back